The last two podcasts have been about the PT profession and some of the critical underlying flaws within the profession. Today's going to be a little bit different. We'll touch on a critical underlying flaw near the end, but today's going to be a little bit different. This is both for the patients as well as the PTs within the profession that are listening to this. So one of the things that we do all the time is we tell people that we want them to exercise to be healthy, and it's something that should be done daily. So we classify neuromusculoskeletal health as exercise. We use, hey, we're going to use these exercises to keep you or make you healthy. And we believe, with absolutely mountains of evidence backing us up, that regular activity and exercise maintains our health and prevents disease. So if you were to talk to the World Health Organization, the WHO, they're going to define something called hygiene as, quote, conditions and practices that help to maintain health and prevent the spread of diseases. Doesn't that sound a lot like what we're trying to do with activity and exercise? Maintain health and prevent the spread of disease. We believe, again, with mountains of evidence to back this up, that if we're active and we do exercise and we have good fitness and good general health, that we will prevent, or at least reduce the risk, we shouldn't say prevent, reduce the risk of heart disease, stroke, any type of other disease, diabetes type 2, you can go on and on and on. If your general health and activity level is better, then your risk of these conditions goes way down. So we're trying to do something that we would classify more as hygiene instead of a treatment. So why don't we present it to patients this way? Why don't we present it to the general public or our clients in this manner? And is there something or a way we can do this so it becomes ingrained in people at an early age? And that's what we're going to talk about after we hit the intro. Don't go anywhere. Stop defending mediocrity in our profession. Welcome back, and thank you very much for joining me on the rehab side of the Dr. Krol PT and Fitness Podcast. This is Monday. It's the rehab edition. I am your host, as always, Dr. Lee Krol, physical therapist. Let's jump right in to talking about neuromusculoskeletal hygiene, which is the base topic I talked about at the intro leading into this. One of the things I like to do is I like to look at other practitioners, other fields that seemingly are unrelated to physical therapy, some that are medicinal, some that are not, and I like to get information from them. What do they do well? What do they not do well? What can we learn from? Etc. And anything I can learn from, that's going to be great. It all helps the PT profession. So I have some level of envy for the dental profession, and they have this never-ending battle. It's a battle they're never going to win, to get people to floss daily. Now, I've heard all sorts of tricks from dentists. I've heard dentists say just floss the front two teeth, and eventually you'll start to get into flossing the rest of the teeth. But overwhelmingly, they struggle mightily with getting people to floss. But one thing that they've done outstanding work on, I should say, is they've gotten people to brush daily. A majority of the public brushes at least once in the morning, but most of them brush twice, 2 times a day. 2 minutes, 2 times a day, that's the slogan. In fact, they even have a website called 2min2x.org, 2 minutes, 2 times a day.org. And it's absolutely fantastic. And people do this without question. They brush their teeth and they don't question it. They don't say, well, why my teeth don't hurt, why do I have to brush them? They don't say that, they just brush their teeth, and it's just the way it is. Think about yourself, for example. You could be running late to whatever you're going to do, whether it's going to work, going out, going to the store, going anywhere. You could be running late, and you're still going to run a toothbrush through your mouth. It's pretty much unfathomable for most people to leave the house without brushing their teeth, especially in the morning. So let's ask the rehab people here. If you're a rehab person, you're listening to this. If you asked your patients or clients to do a 2-minute routine every morning, what do you think the response would be? How well do you think that would go over if you said, every morning, I want you to do this 2-minute routine? You would get a lot of pushback. We would get really low compliance, especially since it's not in response to something that's wrong. Again, people don't brush their teeth because their teeth hurt. They understand that they brush their teeth so their teeth won't hurt, so that they'll have less risk of cavities, so they'll have less risk of having to get dentures early in their lives. They don't want to lose teeth. I mean, a lot of people honestly do it because they don't want to have bad breath, but I mean, let's be honest here, they still brush their teeth and we're still accomplishing the goal. But if you were to ask your patients or clients, do this 2-minute mobility routine in the morning and the evening, people just wouldn't do it. They would just resist altogether. So, I mean, think about giving people just repeated movements to do a couple times every other hour. I have people, I want you to do this 10 times, it'll take you 20 seconds every other hour, and I have compliance issues with that. And when the person sees that it helps them, they see, oh wow, I feel a lot better, my leg doesn't hurt, my arm doesn't hurt, it's not tingling, my back feels better, and they still won't do it. It's unbelievable, the compliance issues that we can have with physical therapy, even when we've shown that it works. So again, how well are we going to do with a preventative or hygienic type of routine? But if you look at the dental profession, and again, I envy them to some degree on this, they appear united in their efforts to ingrain this idea at an early age. So if you look at the dental profession, you look at their governing body, they're united in that front. If you talk to dentists and hygienists in the front lines and the trenches, they're united in their front. The message is consistent all the way around. It's consistent in dental school, it's consistent with the frontline practitioners, it's consistent with their governing body. And so you say, okay, how many times should you be brushing your teeth? They say minimum 2 times, 2 minutes, twice a day. It's unified, it's uniform, they're all on the same page, and they ingrain it at an early age. As soon as people take their kids in to see the dentist the first time, they're all over it. As soon as those kids go to school, the schools are all over it. It's hygiene. It is ingrained at an early age. Yet I do a quick search this morning for morning routines, musculoskeletal hygiene, and I mean, I'm not the first person to think of this. This is a long running idea, but we're all over the place. We have trainers doing their thing. We have yoga instructors giving their ideas on it. We have a couple PTs doing their thing. We have some Pilates instructors, an occasional physician that says we should be doing this, that, or the other thing, and nothing uniform. There's nothing that says, hey, we should be doing this, 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 and this, checking these boxes. Then I'd say, okay, what does our governing body, the APTA, say about this? I type in APTA for movement routines, morning routines, anything like that. Nothing comes up. They may have something, it's just not easy to find. So our governing body, the APTA, doesn't even have anything. So you can take the APTA, you can take the schools that are teaching the PTs, and you can take the PTs themselves. Hell, we'll even throw the PTAs in there. Throw the PTAs in there, and if you were to ask, what should people be doing for a morning routine, we wouldn't agree on the time, the length of time. We wouldn't agree on what they should be doing. It would be all over the map. So if we're all over the map, then how is the general public going to buy in? The dental profession's united. They're all on the same front. They say, okay, this is what we should be doing. The PT profession, we have no idea what people should be doing. We just tell them they should be doing something. And then you leave them off on their own to move on their own in the morning, and who knows what you're going to get. So we would never agree initially on the nuts and bolts, exactly what we should be doing, what thing we should be doing. But can't we come up with something? Can't we come up with some sort of start at least? I came up with something. It takes about 2 minutes, and I want you guys to check it out. I'm going to pull it in right here. Check it out. Take 2 minutes. Take a look at this and see what you think. So that video was approximately 2 minutes long. Took me about 2 minutes to run through that routine. It gets most of the major areas. It's really quick. It's really easy for most people to do. Now, unfortunately, every time I see something like this, you have some knucklehead that comes into the comment section who doesn't understand what hygiene means, who doesn't understand what prevention means, and they talk about their most complex patient. They're like, I have a patient double bilateral, aka double bilateral upper extremity amputation. They can't do this. All right, that's your most difficult patient. It's like telling the dentist, well, how are they supposed to brush and floss? They have dentures. Well, they still have to take care of their dentures. So even your most complicated patient has to take care of themselves. And you get somebody else who comes in that has another condition they're talking about. Well, what if the person has bilateral lower extremity radicular symptoms and they have an extension preference, lumbar extension preference? We're not supposed to be doing that. Again, these things are not diagnostic or a treatment. They're preventative. All right, so don't come into the comments section talking about a patient who may have this issue and you can't do this with them. These things are diagnostic. If you have a cavity, you go to the dentist and the dentist takes care of it. Brushing your teeth is done to prevent dental issues. But when you do have a dental issue, because it happens, even if you brush and floss and do your mouthwash and take care of everything you're supposed to be doing, you're still going to have a dental issue at some point in your life. You go to the dentist and a specific treatment is prescribed after a diagnosis by the dental professional. Same thing goes for neuromusculoskeletal health. Why can't we use a routine like the one I just gave you or something similar? And then when an issue arises, prescribe a specific treatment based on a proper diagnosis by a physical therapist or an orthopedic or a physiatrist or whoever, okay? Why can't we do that? Don't come into the comment section blasting the routine because some patient can't do it. These things are hygienic. They're preventative. So again, we may not agree on the exact routine that I showed you guys in the earlier video, but couldn't we agree that if every person in the country from a very early age, at least this was appropriate for, started doing this twice a day, wouldn't we see less neuromusculoskeletal health issues? If everybody in the country from a very early age started doing that type of movement routine, wouldn't we see a decrease in neuromusculoskeletal health issues? Of course we would. We're all in on early detection and prevention in other areas of health. We get fasting blood draws done to check for diabetes, we get mammograms, we get prostate checks, we do all sorts of things for prevention and early detection. But when it comes to neuromusculoskeletal health, we seem to be completely reactionary about the whole thing. And that's where we have to change the culture. So if you've been listening to this podcast for the last couple episodes, I'm really big on changing the culture and changing the mindset. I'm not so interested in, oh, I'm going to do a podcast about where to put your hands for this type of manipulation. There's millions of videos out there for that. People better qualified to teach it than I am. I want to talk about the culture. And these are the type of things we have to change. Neuromusculoskeletal health, especially when covered by rehabilitation, is a reactionary process, and we do nothing. We have no unified front for the hygienic side of things and how to keep people out of our clinics. And that's what we want. We want people to be healthy. That way we can spend more time dealing with the people who really do need something instead of just, well, maybe if they would have sat up straight for a while, or maybe if they just would have been a little bit more active, they wouldn't be here in the first place. So I talked about the APTA, and I have nothing against the APTA, but they are essentially our leadership group within the physical therapy profession. And that leadership has to invest the resources to change the culture from an early age. We have to get people to think about physical therapy and rehabilitation in particular as something that's not reactionary, but something that is preventative and hygienic. Unfortunately, because we're not all on the same page, we could never approach the general public and say, you should come see your physical therapist every 6 to 12 months to get a screen, to get some sort of a well visit, to make sure you're not moving poorly, to make sure we don't have any issues coming up. Because again, if you were to ask 50 physical therapists, what would you check on an annual screen? You'd get 50 different answers. Some of them would be good. Some of them would be complete garbage. You'd have a physical therapist out there doing goniometric measurements on every joint in the body. It'd be absolutely ridiculous. But again, we have no unified front. The APTA hasn't come up with anything. The schools aren't coming up with anything. And the clinicians themselves, they're not necessarily coming up with anything. So how could we present to the general public that you should move more, you should be more active, when we can't tell them what we even want them to do for a morning routine to make them move better for the rest of the day? So you can tell changing the mindset and changing the culture within rehabilitation and fitness is the overarching theme of this entire podcast. And I want all of you to think about these things. I want all of you from the rehab side to think about what can we do to change this culture. Because if we don't change these cultural things within our profession, and every organization, every group, every field has these issues within their culture that hold them back. And physical therapy, again, is no different. So if we don't change these things, the things I talked about in earlier podcasts, and the unified front here in terms of what should our people be doing, meaning the general public, then we're not going to get anywhere with the general public. We have to address these issues. We can't make them respect us more if we don't have a unified front, if we don't change the culture within rehabilitation. And that's where I would call upon our leaders. And our leaders are anyone. It could be me because I'm taking a stand and talking about this. It's the APTA because they're essentially our governing body, if you will. It could be anyone in our profession, but we have to come to an agreement. We have to come to an understanding as to, okay, can we get on this unified front like the dental profession is? Can we ingrain this in the general public, which requires that unified front, so that we can start making the general public healthier? And that's what we want. It's not about just business. Oh, we got to get as many people in here as possible. There's more than enough patients out there for all of us. What we want to do is keep people healthy and have people look at us as a provider that we should be seeing, much like we see a physician for a well visit every year, a dentist or a hygienist every 6 to 12 months for a well visit. Why aren't we in that same boat? Why aren't we held to that same esteem? And the answer is because we don't hold ourselves in that high of an esteem. Until we do that, until we hold ourselves in that high esteem, the general public will never think of us as anything other than a reactionary practitioner. So think about it, chew on that for a little bit, look over that routine, come up with some of your own. Let's start to kick this can around the road here, and let's figure this out as to what we need to do. Thanks for listening to the podcast. This is the Neuromusculoskeletal Hygiene episode. If you liked what you heard, hit that like button down there. If you liked what you heard, subscribe to the channel. That way you'll always get the guides and the dings and notifications saying, hey, there's a new episode coming out. I usually post them around 11:45 in the morning on Mondays and Tuesdays. That way you guys can enjoy this or not over lunch. Listen to it over lunch. I keep them short, about 20, 25, 30 minutes. Easy to digest, easy to pick up on. I don't like 2.5, 3 hour podcasts right now. Maybe in the future I'll get to a few of those. But hit that like button, hit that subscribe, share it on social media, Facebook, Instagram, Twitter, wherever you want to share it, LinkedIn, it doesn't matter to me. Like it, share it, subscribe, and I will see you next time for the fitness edition of the podcast coming out on Tuesday, which should be tomorrow if you're listening to this sort of in real time. I'll see you later. Good work. Let's get on a unified front and change the culture within the PT profession.